Are you tired of hearing mental health from a superficial view and want to hear about realistic views? Well, you come to the right place, a space where healing is central, but also normalized. Your hosts, Danica and Myra, who are in the mental health field, will explore topics that help promote healing in your everyday life. Through our podcast, you will get the real and the work to focus on your healing. Welcome to Black Women Healing Podcast. All right, so hey, everyone, we are back with another episode of Black Women Healing Podcast, and we have another very, very special guest. I'm so excited for this episode, y'all. It's Dr. Isha Metzger. She is a licensed clinical psychologist, and y'all know we're going to get into her bio, but first, Isha, we start off with a random scenario. So, random scenario, off the top of the dome. All right, so, okay.
No, you don't think too hard. Look like your brain's starting to hurt.
I know. But I be trying to like see what's going on in my life right now, what's happening in my present moment, you know, and trying to figure out what to do with that. Okay. Random scenario. If you opened your door right now and it was a dog right at your door, what would you do with this dog right at the front of your door as soon as you open it?
Close my door. That'd be the end of the story.
What if it wouldn't go away?
I wouldn't know because I wouldn't go outside. First of all, you picked. I have two phobias, and one of them is dogs. So no, like the you should have picked. I don't know, a bird.
Okay, for instance, for you, let's say is cat a phobia? Because these are more of like the more domesticated animals people would normally have.
Oh,
right?
Okay, no, we can go with cat.
Okay. What would you do with this cat? Except it won't leave you alone. It's there every time you open your door.
I would have a new kitty.
Aww.
I actually have tuna, right? So in my end of days prep, I don't usually eat canned food, but I do have tuna. So I would bring the cat in. I would Google how to care for a cat because I don't know how. But I would have a cat and I would be explaining to my mom how I got an animal.
As you can see, it was super random. Myra, what about you? What would you do? Say if a dog or cat was at your door when you opened it and it just wouldn't leave.
I would call animal control. I don't do pets. Specifically dogs. I don't do dogs. I still don't do cats. I just don't do pets unless it's a goldfish or something like that. I'm not doing it. I don't want it in my house. So I'm gonna have to.
Here we go.
I'm gonna say it's a wild animal in my house so they can hurry up and come.
Wild. Okay. Yeah, I'm not really an animal person either. Yeah, I think that I would probably have to call somebody first because my first instinct wouldn't be to what'd you say? Who would you call, Myra?
Animal control.
I wouldn't even think that. I don't even know what to do, so I would have to like call you, and then you would have to tell me to do that. Or I can see me like asking my neighbors, like, "Can y'all come get this cat or this dog? Can y'all come get this?" I don't know what to do.
Yeah, no.
But that's it. It's funny I asked that because my friend earlier today, literally I just got the phone with her and she's one of those, if she sees an animal on the street and just seems like it's lost, she like feels like she has to help it. And she was saying what was different this time because of the coronavirus and how animals, you know, they can contract it too. So she didn't want to pick it up. But she said somebody ended up picking it up and putting it in her car and she drove it to like the nearest shelter. Like the dog, and I was just like, girl, I would never do that. Like, if I see an animal out on the street, I just immediately assume it's gonna find its way to where it's supposed to go. Like, I just do.
I don't think twice. I have a student who's animals, and she always has a new cat and a new dog, and one has a broken leg, and I'm like, girl, you cannot save the animal world right now, but she does and she tries.
So, random fact, there's a shortage of animals in the shelters in California because I guess right when the coronavirus hit, a lot of people were going and getting a lot of animals. So this is like the lowest amount of animals that they've ever seen in shelters.
Well, that's
Really?
sweet. That's sweet. I
Mm-hmm.
have a friend who was online who's single and was like, "Look, who got a dog? I'll babysit your dog. I'll take care of anything you need." So yeah, I'm sure people ran to the shelter and said, "I will adopt
Oh,
something."
that's funny. All right, y'all. So I'm gonna jump into Aisha's bio. So Dr. Isha Metzger is a first-generation American from Atlanta, Georgia, by way of Sierra Leone, West Africa. She graduated from Georgia State with a BA in psychology. Subsequently, Dr. Metzger earned her MA and PhD in clinical community psychology from the University of South Carolina. Dr. Metzger completed her predoctoral internship in clinical psychology at the Medical University of South Carolina, where she also completed her postdoctoral fellowship at the National Crime Victims Research and Treatment Center. Dr. Metzger currently serves as visiting research faculty in the Center for Interdisciplinary Research on AIDS Research Education Institute for Diverse Scholars program at Yale University. In her primary role, Dr. Metzger is an assistant professor of clinical psychology at the University of Georgia. Dr. Metzger has developed a systemic research program aimed at, what is that word?
Elucidating.
Elucidate. Thank you, girl. I'm like, what is that? The role of culture in treatment to better inform outcomes for African American youth receiving services in real world settings. Dr. Metzger's research interests focus on reducing mental health disparities through increasing engagement and enhancing treatment outcomes among underserved minority populations, i.e., African Americans. Specifically, Dr. Metzger is interested in preventing engagement in risky behaviors such as sexual activity, alcohol use, and delinquency, as well as understanding risk and resilience factors. For example, trauma experiences, racial socialization, and discrimination. The impact their relationship between trauma exposure and problematic outcomes such as STIs, HIV exposure, unintended pregnancies, re-victimization, drunk driving, accidents, and legal system involvement. So you guys may be wondering how we even found her. So I had to do a TFCBT training and I saw a Black woman. I was like, who is that? I was shook because I had to sit through 8 hours of training and then to see a Black woman come on my screen. I was like, what? So I literally paused it and I was like, who is this? And I started Googling her. And it was crazy because we had a guest on the podcast and she was talking about TFCBT. And I was like, I literally just learned this from Isha. And I was talking about you. And then I was like, Danica, let's reach out to her. I was like, I don't think she's going to reply, but let's just reach out to her. Yeah, so that's how we found you.
That's awesome. And man, I was a mess and I didn't reply to you guys for like 5 months. But I'm so glad that you got a lot out of that training. I'm so glad that you guys did reach out. I'm so glad that TFCBT is something that at least it sounds like you're getting some evidence based in.
Yep.
Are you practicing right now?
Yep.
Okay.
Yep.
Okay.
And it's crazy because I was telling Danica, I was like, it's crazy to see a Black woman doing this. I want to do it. And remember, Danica, a month later, I got an offer to do the same thing, not TFCBT, but cultural competency. So I had to be a therapist on camera and then just talk about like cultural competency. So I was like, happy that I came across you. That was crazy. That was dope.
Wow, that is awesome. That is one of my prior lives. So I did that when I was on either internship or postdoc in South Carolina. And right now I've actually extended that research. So as you like, everybody I was working with was white, right? So I've continued working with them, but I've kind of branched off of that and I started doing research and clinical work specifically focused on Black kids and how to make TFT work for Black kids. So
I'm excited to hear about this. I'm gonna tell my supervisor that I talked to you because we all have to watch you. Like it's just a part of our training for this job that I'm doing.
yeah,
But we all have to watch you. So to hear that you're furthering your research and making sure that you're including Black folks is so important.
Yeah. And what population are you going to be working with? Ethnic minorities or they diverse?
So I work with foster youth and I do work with ethnic minorities. My population I love is Tay. So I love Tay and I love working with, of course, my Black clients. So that's important. So tell us a little bit about you and your journey to become a psychologist.
So you started off by saying that I'm West African, and whenever I talk about kind of what my journey is, I have to say that because I am West African, it right? Starts long before I was born. No. So my parents came over here in the early 80s. Hopefully I'm not breaking up. I just got a notification that my internet is unstable. Okay. My parents came over here in the early 80s. I was born in a little bit later than that. And a lot of my family came afterwards. There was a civil war in Sierra Leone. So in my household at one point, so I grew up in College Park, Georgia. But at one point we had anywhere from like 6 to 14 of us in the house. And there were a lot of experiences that my cousins, that my adoptive siblings, that my grandparents were telling me about that were traumatic. Um, that were in my little mind, right? Just scary and things that I wanted to help them get over, and I didn't really know how, as opposed to just talking to them, right? So when I got to high school, I was taking AP psychology courses, and my vocabulary started to build, and my understanding around what trauma was and how that impacts developing youth just started to grow, and really my interest in psychology furthered. So like I said, I'm West African, and it was always, you're going to be a doctor, a lawyer, or an engineer. So I had to make my choice, and I went from pediatrician to, once I found out what clinical psychology was, um, I really just felt that that was the best way to treat what I was interested in, and that being childhood trauma. So as you read a little bit of my bio, you can see that I went to a lot of schooling and did some clinical training and some postdoc training in order to make that happen. But really, what I'll say is that my journey has just been one of trying to figure out what makes Black people heal from traumatic experiences, and how to really integrate that into the treatments that we're doing, and making sure that those experiences are heard in the research that's seen in academia as well.
Nice. Okay.
Yeah. Um, yeah, I always find it, you know, pretty interesting when we don't have folks who look like us doing research about us. Very like, huh? So thank you so much for taking the time, because in order to do the research for it to be able to be like in publications, because technically we could all do some sort of research. Yeah, thanks for taking the time to go through all the schooling and everything to get there, because it's a lot of work.
Well, thank my parents, because they didn't give me much of a choice. So
Yeah, you talk to
say, right. So I always say I was gonna do the work somehow, right? So I started off working in cares, and I was a Sunday school teacher, and then I worked in nurseries. But it was really my parents who just forced me to say, listen, academic excellence is also a thing, and that's an expectation. So yeah, you can figure out how you want to do this work that you want to do, but it needs to be backed by something, right? And the older I've gotten, I've started to see, of course, the benefit of using the evidence base and of using to, solve some of these problems that we are seeing.
Yep, for sure. Shout out to your parents.
Right.
Going to this question. So if you all, for you all, because we most definitely didn't say the topic. So today, y'all, we will be focused on Black women and childhood trauma. And as you can see, we have a scholar with us, someone who can really help us break it down. So our first question is, we always want to be most informative to our audience and to ourselves. So we want to start off by defining trauma.
Yeah, so whenever I define trauma, I tell people to think about it on a spectrum. So think about a spectrum of stress on one end and trauma on the other end, where stressors are just our normal everyday occurrences, right? Things that get your heart rate up, things that interpersonally affect you, like an argument with your boyfriend, right? If you take that and it becomes traumatic, that is something like domestic violence. So trauma simply defined instance or an occurrence where you have either threatened or actual violence that is experienced directly or that is experienced vicariously. So it could be something that threatens your life, or something that actually ends the life of someone around you. So that definition is very broad. To narrow it down to give you more traumatic experiences are things like sexual abuse, like domestic violence, like physical abuse and neglect. So different experiences that, again, can either threaten or ultimately lead to death are those that are traumatic.
Hmm. Wow. Yeah. I most definitely trauma is it's a hard one to kind of define because it is like you said it's on a spectrum and different people experience trauma differently or they may have been through one of these things such as I'll say it's a lot of I'm a work with probation and a lot of my clients have been to prison or jail and they be like, oh yeah, I was stabbed, but it necessarily might not be traumatic in the sense that it doesn't leave like they're not having these nightmares, flashbacks. Is just kind of like an experience, and not saying it
Right.
doesn't impact them, but it doesn't really feel like a trauma in a sense because they've normalized it so much.
Right. Right.
And then you hear
So
this
whenever
big.
I talk to people about, oh, go ahead.
No, no, go ahead, go ahead.
So I was just kind of reflecting on your point in that traumatic experiences happen to, say, 60% of the population, right? And of that, we do know, like you said, that most of us are resilient. Most of us utilize our community resources, our family resources, spirituality, our own individual characteristics. Um, and we often are able to go ahead and heal from that. What you just kind of alluded to when you talked about flashbacks, when you talk about the changes that happen to our mood, is something that happens clinically when some people aren't able to heal or to bounce back, and that's often called post-traumatic stress disorder. Again, it's really just a reflection of people's reactions, like you said, to traumatic experiences. So when experience happens, um, like you alluded to, most of us are able to heal, but when we're not, that's when it into something that's either post-traumatic stress disorder or depression, anxiety. You just alluded to flashbacks, nightmares, right? People will talk about headaches, stomach aches, depending on the age, right? The way that their symptoms are, but definitely do encounter stressful or traumatic experiences. It's going to be an individual basis whether or not something clinical develops from that.
Yeah, absolutely. Can you explain any differences between impacts of childhood trauma versus adult trauma?
Right, right. So I said that I'm interested mostly in childhood trauma because I think that childhood presents a particularly one vulnerable time for kids, but also a time where they're still forming identities. They're still able to um, bounce back or heal from what they've experienced. You can correct some of their inaccurate thoughts. You can help their feelings a little easier. So what happens in adulthood when we experience trauma? We already have these views or ideals of the way that the world works. So traumatic experiences in adulthood oftentimes are those that are more surprising. They're the ones that are harder to bounce back from. They're the ones that kind of shake those core values that you have. Whereas in childhood, those core values haven't, either they haven't been developed or the childhood trauma is what is starting to shape those core values. So, like with language development, right? It's easier to develop a language as a kid. So with kids, it's easier to kind of take whatever it is they've been going through and say, yeah, you can think of it that way, but you can also think of it another way. Whereas with adults, we've already got our mindsets and our ways of interacting with the world, right? Um, and oftentimes when we experience trauma, then either, like I said, it's something that kind of disrupts what we're already thinking, or it's just something that's a little harder to get over.
Hmm.
Hmm.
How would you say childhood trauma affects one in their adulthood? Kind of transitioning into that question.
Right. So, for those who experience trauma in childhood who either haven't fully healed from it or haven't kind of fully coped with experiences, we see that in adulthood they have problems either with their relationships, they have problems with their own self identity and their own self esteem. They have problems with the way that they're able to cope and respond to stressors in their life. So that's where you start to see substance use and substance misuse. That's where you start to see problematic patterns of relationships, right? So you were physically abused as a kid, or you saw your mom or your dad physically abused, you witnessed domestic violence, and you you gravitate towards relationships that feel familiar to that, right? Um, so I think that what trauma does as a child is it changes the ways that we interact with people. It changes the ways that we interact with ourselves, right? So our ability to regulate our emotions is something that teach us. If you're in an abusive environment as a child, um, when you're an adult, maybe you get into an argument and you're not as able to regulate your emotions because no one's taught you how to calm down and express yourself when you're angry, right? What was modeled for you was someone who lashed out physically. Um, so as kids, we learn based on what we see, right? Social learning theories what will tell us that okay, if as a kid I see daddy beat on mommy when he's upset, as an adult, if I haven't corrected that thought or that pattern of behavior, that's what I'm going to repeat too.
Wow. It makes me think about how, as a child you could pick up on patterns.
Yeah, it makes me think of even. Oh,
wait, what'd you say, Danica?
No, go ahead.
I was gonna say, it just makes me think about like if you don't work through childhood trauma, how when you have a child, like I'm just like imagine like what that looks like, and I'm like, oh my gosh, wow,
Right.
I can't even imagine.
All these processes are different, but I think what you're alluding to, they're physically abusive or emotionally abusive or neglectful childhood environment, right? So if you don't have a parent who sat down and looked you in your eye and talked to you about your feelings and said, okay, we're going to take 3 deep breaths and we're going to calm down, right? If you have a kid who's freaking out and throwing a tantrum like kids do, you're not going to have the skills or the resources to go ahead and help your kid regulate their emotions unless you've done something to proactively go out and again correct that experience that you had in childhood or just teach yourself, right? Which is a lot of what, as you know, Myra, we do in therapy is just correcting some of the inaccurate thoughts that we have, some of the inaccurate patterns of feelings, right? Um, in trying to reverse kind of what we either have learned or haven't learned in childhood.
Yeah, that's pretty much exactly what I was gonna say about those like the CBT with the distorted thoughts. Like really over like the span of your life, you are picking up on all of these different like beliefs and thoughts and so once you if your childhood was filled with all this trauma, once you get to adulthood, you've either accepted or dismantled some of these thoughts and beliefs, and some of them that you may have accepted may be negative to how you want to maneuver in life. And so like it's like extremely important, I think, to kind of constantly, regardless of trauma in general, but just kind of to constantly really think about your beliefs and where they come from and if you agree with them or not. And if you want to work on like changing them or rationalizing them or trying to figure out how is it worthy to you to have this thought. Yeah.
That's powerful. In your experience, what are the top 3 common traumas that Black women face?
Black women specifically. So I would say the same I listed for childhood trauma, so abuse and physical abuse. When you think about Black women, intersectionality, right? So they are women and they're likely to face sexual abuse, but they're also Black. And racial stress and trauma is something that both know impacts women, impacts Black people. It's something that is unique to this population. So that could be our day-to-day instances and occurrences of microaggressions when you're talking to a white coworker. That could be vicarious racial trauma when you're seeing Breonna Taylor every time you scroll up and down your timeline, right? When you're seeing Armand Arbery, right? So just different instances of racial stress and trauma, I think, are important to consider when we're thinking about how Black women are navigating in their day-to-day lives. And of course, the instances of sexual and domestic violence that they experience as well.
Can you let our listeners know what racial stress is? Because I don't know if they know what that means. Like, just give a little definition of it.
Yeah. Um, so like childhood trauma, interpersonal trauma. So racial trauma is a traumatic experience that you encounter simply because of your race and ethnicity. So in this case, because you're Black. And these are experiences that, just like physical abuse or domestic violence, are predictable, they're uncontrollable by the recipient. They're ones that, if we experience them, they lead to hypervigilance, they lead to us being triggered, all the same things that we think of when we think about interpersonal trauma. Um, are the same factors that are relevant when we think about racial stress and racial trauma. And as well, right? So if you think about a microaggression and someone saying, "Oh, you speak well for a Black girl," right? That's one thing, as opposed to you getting pulled over and beat up by the police.
Yeah.
So that spectrum exists as well. And then, listen, we're Black women, so let's talk about historical trauma and systemic racial trauma, right? So we're dying in childhood. Just thinking about different traumatic experiences that to us on the societal level as well are ones that every day as we're going through this society, we're having to combat and contend with.
Yeah, it makes me think, like, because you mentioned the word intersectionality, I'm thinking about you and you being a psychologist, and I'm just wondering, I'm sure you've experienced trauma. It's life, right? So I'm just wondering, how do you navigate, this being your niche, and then you also experiencing it in your personal life?
Yeah, I mean it's I think, like with any profession, right? So you have a medical doctor who has diabetes. They know what to do, but they're not going to manage it the best, right? So
Yeah.
I would say that I work on the same strategies that I tell my clients to work on. I focus on my thoughts. I focus on being very mindful of how I feel. I focus on my reactions, right? Um, I focus on behavioral activation, which, if you just think about it on a very basic level, that's self care, right? Taking walks, treating well, doing things that are going to prolong my physical health, but also my mental health. Getting out in the sun is not just because, right, my melanin needs to pop, but it's also because it's going to lift my mood, right? It's going to give me more patience when I need to talk to somebody later in the day who I don't want to talk to, right? Um, Help me later if I am triggered, right? Knowing how to take deep breaths to calm myself down, knowing that, listen, these stressors are happening, but when I go home tonight, I'm going to be able to take a bath, right? So self care, and really just talking to myself nicely and being kind to myself. So, and when we think about traumatic experiences in childhood, right, these are messages that you can receive from I just talked about a civil war in West Africa, right? So this could be violence that's going on in your community, Black Lives Matter, and violence that's going on right now here. But this could also be messages that you're hearing in the media that you need to combat, right? So someone telling, I was about to say SZA, but somebody just told some beautiful Black queen that she had a bulldog face, right? So being able to combat those messages in the way that I talk to myself and think about myself um, are the same things that I tell my clients when they're dealing with their own traumatic or stressful experiences. Um, and yeah, it is a daily task. It is a lifelong journey, right? So you guys asked about healing from childhood trauma in adulthood. Even if you go to therapy and you're done with therapy, right? The strategies and tools that we give are not just for while you're in therapy. It's for when you're done with therapy. So I always tell clients, you're working out and you're getting in shape and you're eating right. If you get done with your trainer, are you going to be done with therapy, right? Are you going to be done and say, okay, I'm done, now I get to get fat again? No, you're going to say, I'm going to keep working on what I've been working on. So even though I have these tools, even myself as a trainer, I do make sure that I am eating right and taking care of myself and doing what I tell my clients to do.
Yeah, absolutely. I know you kind of mentioned a little bit, but outside of therapy, how can one just start their healing journey involving childhood trauma?
So the one tool that I think is really important is to really be mindful of the connection between what you think, how you feel, and what you do. So hopefully, Myra, this is familiar to you, but I just described what's called the cognitive behavioral triangle. Never
Mm-hmm.
those words when you're talking to somebody on the street, but there is a connection between, right, what you think, how you feel, and what you do.
Yep.
And I think that as much as you can be mindful of that in any situation, and as much as you can try to have positive and helpful and accurate thoughts, the more you will have beneficial feelings and positive feelings, and the more that you will act in a way that is conducive to how you want to act. So I give my kid clients kind of an ongoing example. And this is for someone who's experienced childhood trauma, but again, we're thinking about it on a spectrum. So this could be something where it was a life and death situation where your parents were beating on you every day, or this could just be you growing up a regular kid in a low income neighborhood, right? Mm-hmm. So an example that I would give would be to say you walk into a cafeteria, you look over at the table that you want to walk over to, and everyone starts laughing. What's the first thing you think, Donica?
Oh, Danica. So,
Danica.
thank you. I would say I'm a kid, right?
Mm-hmm.
I think as a kid, I was like, oh, they talking about me. Like, what are they talking about?
Mm-hmm.
Right. So if you walk into the cafeteria, everybody's talking about you. How does that make you feel?
I would feel embarrassed. I probably feel hurt, which would make me feel angry. Probably like I want to approach them.
Oh, there you go. So right. So you just completed the triangle. You thought one thing about me. You felt, and what did you do? You just went over to that table and sounded like you were ready to fight, right? Keep my mouth. Which I don't say, right? So that was me when I was younger. So job of your therapist, job of just you in the situation, as a kid who wants to work on either feeling better or behaving better, not getting in fights at school, right? What I would say would be to challenge that initial thought that you had. They talking about me. How can you challenge that for either accuracy? How can you challenge that based on the way that you think about yourself? So that would be to say, I don't know if they're talking about me. Maybe someone just told a joke. Or that would be to say, there's no reason strangers should be talking about me when I'm cute and I'm funny. Let me go see what's up, right? And now instead of feeling embarrassed, I'm feeling confident. Maybe I'm feeling curious. Maybe I'm feeling, who knows, right? But just by changing that thought where I was sure somebody was talking about me and I'm embarrassed and I'm gonna go fight, now I can approach the situation feeling a little better, a little more confident or curious or optimistic at least, right? And then I can walk over to the table. So someone who's been abused, someone who's been neglected is more likely to have a negative or an inaccurate thought. Someone who lives in a stressful environment is more likely to feel antsy, right? Is more likely to act out. So our job as people who want to work on how they're handling themselves, people who have been traumatized, who just want to feel better, or to be better, right, is to challenge our initial thoughts to be more positive, or to be more accurate, or to be more helpful. And the older we get, the better we get at that, the more used to it we get. And hopefully when it comes to adult situations, right, if it is you and a coworker and you sure she's been talking about you, right? Changing your initial thought of with different feelings and then having a better outcome.
For sure. Well, we do takeaways, but it sounds like and I don't want to speak for you, but a good takeaway would be to be mindful of the connection of how you think, how you feel, and what you do. Is there anything else you would want to say as takeaways to our audience?
No, I do think that that is the most important. If you're able to target any one of those three domains, right? So I talked about behavioral activation. That means to say, if you're more active, if you're taking better care of yourself, your thoughts are likely more positive about your feelings. If you could just go in and target your feelings with deep breathing, with a bath, with, right, aggressive muscle relaxation tools that we teach in therapy. But if you can target any one of those three domains, you'll be in a much better place in terms of like your overall functioning. So yes, be mindful of your thoughts, your feelings, and your behaviors, what you do, and hopefully that connection will be more positive overall.
Most definitely. At first, when I was watching you do the video, I was like, this don't work. Like, just watching it, it doesn't seem like it works, right? And so
Yeah.
it's my job, and for me to be certified, I have to practice it, and I have to do these phone calls, so I have to show that I'm really doing it. So one of my clients, she has a long trauma history, and so I was kind of scared because I was like, she has a lot of different pieces. I don't think this is gonna work. But I was like, let me try it out. And oh my gosh, it's been so helpful. So now I'm like, okay, TFCBT does work. And the cognitive triangle does work. And I like that you can do the cognitive triangle with different clients, because I don't use TFCBT for all of my clients. But even for like my clients where I do like solution focus or like narrative, I still use the cognitive triangle because it still makes sense in different settings. So I like it.
Yeah. I think even when you haven't been traumatized, if you're just working on being depressed or being anxious, or even OCD behaviors, as long as you can make that connection, the cognitive triangle, I definitely think works. I'm so glad you're able to apply it in your therapy with these kids. It's definitely, like I said, the more that we become familiar with it, I think the easier it is for us to use in day-to-day and especially with our clients.
Yep, for sure. Well, thank you so much. And yeah, we'll have you back soon. Thank you so much.
I appreciate your time. I see the countdown going. Well, thank you so much. Please, I will look forward to seeing great things from you guys in the future.
Thank you.